in DBT, we are chronically talking about vulnerability factors, things that leave my client vulnerable to the emotional experience that they're having, to the typical trauma responses that we might see in the fight, flight, freeze, fawn experience. And diversity is anything that deviates from what either a system or a collective of people consider outside of their experience. So when I'm talking about diversity, it's like when it relates to you, it's anything different than you. And then systemically, if it's anything that deviates from what the system considers the norm, would be diversity. So anything from socioeconomic status into those racial and ethical differences, in the LGBTQAI category, in differential diagnostics category. So there are so many places that I'm looking at diversity, and I simply think of diversity as a vulnerability factor for my clients because of that the early developmental trauma, systemic trauma, generational trauma that these populations experience.
It's almost like if you have, this is an application, if you have a complex case and you're trying to figure out how to apply what we're saying, you're going to look for any diversity factors that might be contributing to their presentation and how that affects what you're seeing. And so I think when you look at it that way, statistically, you're more PTSD increases as diversity occurs. So that is, it's correlated, or it's related to it. So I think diversity is an important part of what we're doing in our office and addressing it. So, and in the neurodivergent, I mean, in the diversity stuff, I always include neurodivergence as well, because those are invisible differences, but they're present. And so it does make people more vulnerable to being traumatized or bullied, you know, that developmental trauma piece. We're back to that, right?
Yep. And every statistic done, every research that has actually been completed, so we know the numbers are probably far supersede what is in the research, but everything in the research and the statistics do tell us that when there is a diversity component, we are looking at more likelihood that symptoms of PTSD, experiences of trauma have occurred.
Yeah.